My name is Dr. Shatia Edwards, and I'm a board-certified obstetrician and gynecologist with Carrollton OBGYN. I made the decision to become a doctor when I was about 4 or 5 years old. We were asked to write what we wanted to be in the future, and at that early age, I knew that I was going to be a physician. I decided to specialize in women's care after I participated in a missions trip. I went to Honduras, and I was allowed to work with some OB physicians there. I was allowed to be in the operating room with them and do hysterectomies and do vaginal repairs. I was also able to do the routine care in the clinic with providing routine prenatal care and routine gynecological care as well. What I'm most passionate about when it comes to women's care is just making sure that women have their voice heard, that when they come to the doctor and they have concerns, that it's just not swept under the rug, that someone is actually listening to them and taking that into account when they're coming up with a plan of care in order to have them feel better. What I hope that patients take away from the visit with me is that the plan of care is always shared decision making. So I may make a suggestion, but it may not be what is best in the patient's eyes. And so then we come up with another plan that we think would best or better suit that patient and their needs in their healthcare management. Some of the patients I treat are my young and healthy college students who just want to talk about birth control. I treat patients who are here for prenatal care, whether they're young or our advanced maternal age patients or our high-risk pregnancy patients. I treat patients who are having abnormal periods and abnormal bleeding who may need surgical intervention like hysteroscopies or uterine ablations or robotic or minimally invasive hysterectomies. I also treat patients who want to manage their periods a little bit better with hormonal control of their cycles. Some of the surgeries I perform would be laparoscopic salpingectomies, which is basically when you're done having children, you don't want to have children anymore. I do a lot of cesarean sections. I do a lot of hysterectomies, whether they're minimally invasive or not. I do a lot of hysterectomies and hysteroscopies and endometrial ablations for heavy periods. Some of the advantages of having me do these procedures here at Tanner is, number one, where I'm already familiar with my patients. It's definitely a community feel. Tanner is one of the best hospitals in the area, some of the best facilities that are here in the metro Atlanta area. They have the ability to complete minimally invasive techniques. The staff and the OR staff and the facility is top tier. And so that is some of the advantages of having a procedure done here in Carrollton at the Tanner facility. When I meet with my patients, what I want them to take away is that I truly do care about them and want to see them get better and want to see whatever concern that they came to me about, that I truly listened and I truly cared about what they were saying and that I want to see them get better.